I am joined now by Toronto Professional Firefighters Association member Paul Atkinson. Good morning, Paul.
Good morning, Joel.
So, Paul, I know that a memorial is fast approaching for fallen firefighters. When and where is that memorial going to take place here in Toronto?
It is, I believe, 2 Sundays from now.
And Paul, how many names are going to be added to the wall as line of duty deaths this year?
Joel, this year we've got 4 names going on to our memorial wall. All of the names that are being added are related to cancer deaths.
And how, when it comes to those types of cancer deaths, how are line of duty deaths defined by the city and by 3888, the Toronto Professional Firefighters Association?
Well, the definition that we use is any time that a name or a claim is recognized by the Workplace Safety and Insurance Board, the WSIB, then it is recognized as being a line of duty. There is one other aspect that we look at. We have a group of firefighters, older firefighters from the former city of Toronto, that were actually exempt from workers' compensation benefits if they started before 1968. So the test that we apply for that group is that if they would have achieved benefits in Scarborough or Etobicoke, then we recognize those members as having died in the line of duty.
Paul, I know that you're also the WSIB rep for the Toronto Professional Firefighters Association. Tell us about the work that you've done with the WSIB together with other members of the labor movement to get the WSIB to recognize more job-related illnesses that come from workplace exposure.
Well, our involvement, or at least my involvement, really began, I would say, just around the time of amalgamation of the city. And what occurred at that point in time was that we had a member on the board of directors of the Workplace Safety and Insurance Board from the Oshawa Firefighters Association, Chris Griffin. And Chris was able to set up for us meetings with the compensation board with people that made decisions. And what we were able to do was identify that there was problems in the system, there was gaps and things being missed, and what we did was we began to present our claims. First off, we were doing a lot of claims. We were just filing any cancer claim that came our way. And then what we were doing is, rather than holding back our information, our medical information, our scientific information, we were actually presenting that to the compensation board in a forum of, senior staff, adjudicators, that sort of thing. And what we found was a highly receptive audience to what we were saying, how we were presenting our cases, as well as what we were also doing, Joel, was we were working in good faith with the board to really help them do their job more efficiently. So when we first got going with these claims, it wasn't unusual to see 2 years go before we had a decision. And we identified that was kind of unacceptable, seeing as many of these people pass away well before 2 years when they develop a cancer. And so what we did is we identified where the delays in the system were, and we began doing a lot of the gaps and filling in for the WSIB, such as obtaining statements for them to work on a list of doctors. And in some cases, in the early days, we'd actually go out and get the medical from the hospitals, the doctors, that sort of thing, for the board, so that we didn't have to wait for them to request it and whatnot. And as a result, we've taken the time frames to get a decision on a claim from 2 years down to probably between 3 to 6 months is our usual turnaround.
Paul, and for our listeners, I guess it's easy to understand that firefighters, in going into burning buildings, come in contact with a lot of different carcinogens. But which cancers in particular have you noticed, and has the wider firefighting community seen an increase of, or see higher rates of, that are related specifically to the exposures that are taking place on the job?
Well, we have a list of presumptive cancers right now, and we have brain cancer, non-Hodgkin's lymphoma, leukemia, colon cancer, kidney, bladder, ureter cancer, esophageal cancer, and wasn't counting, but I think that's our list of 8. And those are the ones that we see that, like the bladder and the kidneys, we see those are the filters of the system of the body that, filter all the chemicals through, so that explains that one. The brain, just is a organ or is a part of the body that the carcinogens just love to sit in and accumulate. But, in addition to those cancers, we also, like I say, I've probably filed between myself and Colin Grieve out of Hamilton, who I work with at the provincial level. I think we're up around 15 to 1,600 just cancer claims. Now, that doesn't include the heart claims that we put in, post-traumatic stress, other really complex claims. We're also looking at other cancers such as multiple myeloma. We're seeing an increase in lung cancer for non-smoking firefighters. Skin cancer is another one that we've seen a huge number of claims for, as well as respiratory claims such as chronic obstructive pulmonary disease. So there's still a lot of work to do in terms of recognition, and we continue to meet with the compensation board to to advance these issues with them. And it's one of those things that it's never ending, because every time you turn around, there's other things that we're identifying, and we're seeing huge issues with post-traumatic stress amongst the membership. We just recently had about a year ago now, that a member had committed suicide, and we worked on that claim and got that recognized as being related to his work exposures. So there's a lot of things that firefighters do and see and experience and are exposed to that has real harmful outcomes to their personal health. And our goal is to, first off, reduce and eliminate those risks, better personal protective equipment, better support groups, things of that nature, that we don't get ourselves into these health problems down the road. And, for the employer side, we feel they're completely on side, because these claims cost a lot of money to the city, and they don't want to pay the money out, and we'd prefer them not to pay the money out in all reality, because if they're not paying the money out, that means that we don't have sick firefighters passing away from these cancers.
And Paul, just as we wrap up, what does it mean when you can get a disease presumptively recognized, as you said, what does that mean to the firefighters themselves when they become ill? What does that actually mean for the firefighters' families when you can do the work that you've done to get to the place where there are at least some of the diseases, as you've mentioned, that come from these workplace exposures are presumptively recognized by the WSIB? How does that make life easier for a firefighter who's fallen ill, or for the family of that firefighter?
Well, what that means, Joel, is that we're able to, these are presumed to come from job exposure. So if somebody should develop a brain cancer, for example, we don't have to go through their employment history with them, prove that they were at fires, the length of time that they were at fires, because up until the presumption in 2007, we would document as much of their work history as possible, keeping in mind that there's very incomplete records for the firefighters. They don't keep good records of what they do and how they do it. So we had to accumulate as much information as we could on that. So now what happens is that for that firefighter who unfortunately develops brain cancer, we do up the paperwork, we get the information, the core information of who they are, where they live, et cetera, social insurance numbers. And then once we have proof of employment from a specific period of time, and it's in brain cancer, you have to have a minimum of 10 years firefighting experience to achieve that. Once we prove those aspects, that they were employed as a firefighter for greater than 10 years, once we can prove that the biopsy results show this to be a primary brain cancer, then the claim is approved immediately. We don't have to do any further investigations. We don't have to say, well, what about this or what about that? And the onus is now moved to the employer group to rebut the presumption, and they have to come forward with actual evidence that says, here's where this person's cancer came from, and it wasn't, occupationally related. So the shift is huge, and for those claims that aren't covered by presumption, we go right back to brass tacks and do our work and continue to document as many exposures as possible and to advance our claim. And, I'll be honest with you, there's a lot of firefighters that, used to be things before they were firefighters, and electricians, tradespeople, mechanics, that sort of thing. And we've done a number of claims where the actual diseases were related to their pre-firefighting exposure. So there's a lot of things that you can look at in people's lives and histories, and there's things that you can draw from that. Firefighting isn't the only hazardous occupation in our country. There's a lot of hazardous occupations and a lot of exposures that occur. So that's what we do is for these presumed ones, we can just race right to the conclusion. And for those that aren't within the parameters, then we do our work and see if we can get these people benefits.
Thank you so much for joining us bright and early this morning, Paul. And as you say, certainly workplace exposure is an issue that cuts across many, many sectors, not just firefighters, although it's obvious to see how it comes into play there, but certainly in many sectors. Thanks for being with us this morning.
Thank you, Joel. Have a great day.
You too. That was Paul Atkinson, a member of the Toronto Professional Firefighters Association, and he was here to talk about workplace exposures. And as he said, they're adding 4 names to the memorial wall, line of duty deaths, all related to workplace illnesses. And you can find information about that memorial on the City of Toronto's website, www.toronto.ca/fire. The memorial will be taking place on June 12th, which is a Sunday, at 11 a.m., and everyone's welcome to attend. Will take place at Toronto Fire Station 334. That's located at 339 Queens Quay West. So Sunday, June 12th, down on Queens Quay will be the ceremony, and everyone is welcome to attend. I want to thank Paul for joining us this morning. And as he said, of course, workplace exposure is not just an issue for firefighters. Of course, it's an issue for many people across the spectrum.